I'm Bec Peters, known as Bec, at the Royal Children's Hospital, where I work as a transition support worker. I'm a part of a team who facilitate and help prepare young people and their parent carers for transitioning to adult healthcare services. In life, we all have lots of milestones that we reach, finishing primary school and going to high school. And so transitioning from a pediatric healthcare setting to an adult healthcare setting is another milestone. It signifies that they've reached the end of their journey in a pediatric setting and they're now old enough to commence care in an adult setting. As we all get older, we go through different phases in our life, considering family planning, pregnancy, contraception, all those things. This is where the adult system is going to be unique and different from a pediatric setting. Those changes don't mean that your care is any less. It is just a change in the process in which they do things in their system. Adult specialists, they will talk to you. You are their patient, and that's a part of going to adult healthcare as well. When we're talking about the first phase of transition preparation, ideally we would love young people and their families to be thinking about that when the young person is about 12 to 15. And that can be really small introductions. So everything in terms of concepts and understanding a medical condition, involving your child in those conversations around the dinner table of your heart condition and the name, those small factors really make a difference long term. Stage 2 is 15 to 18. And so that's where I spoke about earlier, that preparation phase of really young people becoming more involved in their healthcare. What that might look like is involvement in medication management, involvement in scripts process, knowing the names of your medications. You don't necessarily have to know the dosages or the times in which you're taking them. For a young person who might be dependent, then we'd recommend things like having a list for that young person so that they have that list on them at all times. A lot of that education and knowledge has gone to the parents and carers, understandably. So what we would say is that that parent or the carer is the expert and the young person is the apprentice. Transition is not going to happen overnight, and we know that. Setting achievable, realistic transition goals early on, those are the things that parents can do to help empower their young person. So for young people with neurodevelopmental needs, the transition phases would be more aimed at the parents, providing confidence in their young person in a different form. Really helpful things that we know from our clinics with parents is early preparation and planning. Speaking to your pediatrician really early on to identify a good GP in the community and starting that relationship with the GP a few years prior can be extremely beneficial. Generally, transfer occurs once a young person has finished school. They'll likely have their last appointment early in the following year with their cardiologist. They'll have their final kind of review and then transfer to adult care. They will have done a big, beautiful referral package that'll have your detailed referral letter, all your scans and investigations in it, and they will then send that to the adult service. In terms of entering into an adult healthcare setting, those referrals that have been written are extremely comprehensive, especially in the cardiology world. If the adult team has a question or a concern or they're not sure, they will very easily communicate with the pediatric team. A copy of that referral letter and those investigations and any other reports that have been sent will also be sent to your GP and or pediatrician if you have one. Once they receive it, you'll get your appointment and then you'll have your first appointment in the adult service. Some of the tips that we would recommend are utilizing resources that are available to you so that as a young person, you can be as prepared as you can be by the time you reach your new adult specialist. One of the tools that you can use as a cardiology patient would be by utilizing HeartKids Upbeat app. You can utilize the HeartKids website. They've got dedicated pages and resources written about transition to help young people and their parent carers. Setting phone alarms to medication reminders, keeping track of your appointments, that's going to take practice and it might take a few months. We just want young people to not feel like a goose. You don't need to know everything about it, but having a good foundation is key, and having that in your phone is going to hold you in really good stead. So I guess a summary of, in terms of transition preparation and what would make a really ideal transition: knowing your original diagnosis and any subsequent procedures that have happened, medication knowledge and medication management, so knowing the names and dosages of the medications in which you take, keeping track of your appointments, so whether it's in your phone, using a patient portal, using the Upbeat app, so keeping track of your hospital appointments, and having a really good GP, someone who you can go and see whenever you need to. When it comes to transition, we like to talk about it as being a lifelong learning opportunity. You're not going to get everything right the first time, and no one expects you to. Always have a go and do your best. You're not sure, or you're not feeling right, or you've got questions, just ask. The medical teams, they'd always want you to ask rather than not ask at all. So be a lifelong learner throughout your whole journey as you enter adulthood.